All right. Hi, I'm Dr. Mike Gorman, and I wanted to talk today about traditional medicine and in particular traditional diagnosis. So typically, the way that we come up with a diagnosis is actually based on a collection of symptoms. The problem with that is, I remember being in school and you would read every known disease in Robin's pathology textbook and you start thinking, wow, I think I could have that because there's all these lists of symptoms and it's got nothing to do with the individual, it's just a collection of symptoms. Now, if we were to look up here, this is one of my favorite posters because it says symptoms are misleading, the top of the iceberg there, we find the hidden cause. And so really our goal is not to suppress symptoms. In traditional medicine, their goal is to suppress symptoms, either save your life if you're dying, or give you a pill or give you something to suppress or try to cover up or get rid of your symptoms. So it's very suppressive in nature. Chiropractic and alternative medicine, holistic healthcare, applied kinesiology is really expressive in nature as opposed to suppressive. We're trying to get your body or nervous system to heal itself, express itself as well as it possibly can. So I want to talk a little bit about a couple examples of symptoms and how crazy it can actually be. Let's take, for example, fibromyalgia. What is fibromyalgia? The definition of this, fibro means joint, mya means muscle, algia means pain. Fibromyalgia actually means pain all over your muscles and joints of which we don't know the cause. Now this is a medical diagnosis, but here's the problem. You go in with a collection of symptoms, they can't figure out what's going on, they do some blood work, this, that, everything's normal, and then they say, there's nothing wrong with you, you have fibromyalgia. All that means is you have a collection of the symptoms and we don't know what's wrong with you. People come into our office and say, I wish you could help me with my fibromyalgia, or I meet them out in the street or at a lecture, and I say, well, what makes you think we can't? Oh, the doctor said there's nothing they can do. Well, they're right, there's nothing they can do. It doesn't require drugs, it doesn't require surgery, so therefore, that's the case. If you go to a butcher, they're going to give you meat, right? If you go to a medical doctor, they're going to rule out something serious, which is awesome, then they're going to either give you drugs or surgery. That's what they do. Would you be surprised if you went to an acupuncturist and they wanted to put needles in you? Or you went to a nutritionist and they actually wanted to give you diet recommendations or supplements? Of course not, right? But we don't think of it that way. Let's look at a couple more quick examples. Chronic fatigue. Chronic fatigue. Someone comes in and says, I have a lot of fatigue. They do some blood work, it's normal. You have chronic fatigue syndrome. People walk around like they caught this bug, call it chronic fatigue syndrome. All that means, it's ridiculous, right, is you have chronic fatigue and we don't know what's causing it. The reason they don't know what's causing it is because it's functional in nature, not pathological in nature. Doctors are great at dealing with infectious disease and serious things. If it's not that, then you belong in an office like ours, more holistic, where we can actually look at what's dysfunctioning. IBS, irritable bowel syndrome. What is that? You have a whole bunch of digestive stuff of which they don't know the cause. It's not reached the point of pathology or anything serious yet, so they call it irritable. You say, my bowels are irritable. You have irritable bowel syndrome, right? Depression. You go in and say, I'm a little bit tired, I'm a little bit depressed. Immediately, they want to say, okay, here's some medication for that. It's a chemical imbalance of the brain based on a few questions and symptoms, okay? Colic. Colic is another great example of uncontrolled crying for 48 hours of which we don't know the cause. And yet, we get phenomenal results with colic by doing a super gentle adjustment. And I'll have another video on colic where we explain in detail how we treat it very gently, safely, and effectively. So, to wrap up that, medicine is going after the symptoms. We're actually going after the root cause.